In today's world, we are facing some of the most significant health crises of our time. HIV, monkeypox, and COVID-19 are all diseases that have caused immense suffering and devastation around the world. These diseases have disproportionately affected Black communities, highlighting long-standing racial health disparities that continue to impact our society today. In this documentary, we will explore the impact of these diseases on Black communities, including the historical and contemporary factors that contribute to these outcomes. We will also highlight the community-led solutions that are working to combat them. HIV is a virus that attacks the immune system, leaving the body vulnerable to other infections and diseases. Since the first cases were reported in the 1980s, HIV has become a global epidemic with over 38 million people living with the virus worldwide. Despite significant progress in treatment and prevention, HIV continues to disproportionately impact Black communities with rates of infection and mortality far higher than any other racial or ethnic group.
I have been very fortunate over the past 32 years to work in HIV. During that tenure, I've had a chance to work predominantly in the Southeast. So I've seen the highs and lows in HIV movement for the Black community. This country has given Black people a reason to mistrust the medical system. And so as we fast forward to some of the challenges that we have experienced today, from HIV to COVID to Mpox, and we are having these discussions about why Black communities aren't showing up in ways that other communities are, we can say, pick a research project and we can tell you why we're experiencing today what you did to us before.
Black people make up only 13% of the United States population, but in 2019 accounted for over 42% of new HIV diagnoses. And Black, gay, and bisexual men accounted for 66% of those diagnoses.
So Thrive is a nonprofit for and by Black people living with HIV. We started as a support network for Black gay men living with HIV, and then we began to expand from there. Our mission is to achieve health equity for Black same-gender loving men through advocacy, direct support, and building collective community power. Initially, our mission was centered around just men living with HIV, but as a person, a Black person living with a chronic illness, you began to quickly see that the reason that you're in this situation, the reason that I'm in this situation is not because of the fact that I'm Black, but because of the lack of health equity. So we wanted to do something that celebrated and supported our whole lives. Black people everywhere are experiencing these disparate viruses and pandemics in very unique and interesting ways, and it's because of the social political context that we live under.
COVID-19, the most recent addition to this list, is a respiratory illness caused by the SARS-CoV-2 virus. Since the first cases were reported in 2019, COVID-19 has spread rapidly around the world, causing widespread illness, death, and disruption. Once again, Black communities have been hit particularly hard by this disease, with higher rates of infection, hospitalization, and mortality when compared to other racial groups.
Having worked on COVID since the very beginning, actually since the beginning of the beginning, right. I think it was just like, oh, we're doing this again. We're missing the mark, we're missing the boat again. Yes. I think that there are lessons that can be learned from the experience that we might be able to take in order to ensure that our efforts moving forward are much more successful. there's lots of things that I think could have been done differently in the response for vaccinations. I think that the delay in mobilizing community-based organizations and faith-based organizations and other groups that have those strong relationships with community to set up those community vaccination sites, the delay in doing that in many jurisdictions was a failure. And it was a reminder to me that not only have we as a field not taken lessons learned from COVID-19, but we've also not taken lessons learned from HIV.
COVID-19 has further highlighted the existing racial health disparities, with Black people being more likely to contract and die from the virus.
In this great state, there was a vaccine site created, and some of the leadership in the state office talked about the disappointment of folks not accessing this particular vaccine site that was created and designed really for folks that were living around that zip code. And they could not understand why we wouldn't utilize the service that for them was designed and centered within our community. So here are the challenges. There is no free parking in downtown Atlanta. If you created this for communities that were disproportionately impacted, clearly you did not consult those communities, because they would have shared with you, this is not a great location. When people were losing their jobs, when folks had to go home without pay because they are not salaried, when it comes down to a $15 or $20 parking fee to get the vaccine or to feed my family for the next 3 days, I will take the latter, Alex. Until we address those infrastructures, doesn't matter what would come next. Who knew that Mpox would come next? And you see the same outcomes as you saw with COVID.
As monkeypox vaccines roll out, not everyone who is eligible is receiving equal access.
We know that this is systemic. We know that this has been going on for hundreds of years.
White recipients account for 77% of all monkeypox vaccines distributed.
Monkeypox, now known as Mpox to reduce stigma, is a viral disease with symptoms similar to smallpox, but less severe. It primarily occurs in Central and West Africa and is transmitted from animals to humans. In 2022, we saw Mpox portrayed as a disease that was only affecting Black same-gender loving communities.
There was some messaging that went out that suggested or implied that only people who identified as LGBTQIA were susceptible to Mpox, and it's not true. And so I think when that kind of messaging is released, because of stigma, because of social norms, it sort of says to people who are not a part of that group or that community that they don't have anything to worry about, that this is not a disease that can impact them.
Right.
And that is a misperception that we continue to be haunted by, not just in terms of Mpox, but also with HIV. And so I think it's really important that the messaging be accurate. And part of how we do that is by mobilizing community to co-develop the messaging. Because part of the failure of messages that have gone out before is that they've come down from people who don't look like us.
From higher rates of chronic diseases to poorer health outcomes and limited access to health quality, Black communities have been at the forefront of fighting for health equity in the United States.
We're hearing about Mpox, which is not new. You know, I mean, a lot of people the only thing new about Mpox is that we're calling it Mpox, right? And for over 50 years, we called it Monkeypox when it was, ravaging Black communities in Africa. But when we saw that, oh, this is coming to our shores, right? Now like Americans are threatened to get it, and they're saying it's highly indicated for black same-gender loving people, and now black same-gender loving people. So we're seeing a lot of these cases, and we knew. First off, we're still dealing with the community level trauma from COVID. Now we're preparing a response to Mpox, and we're like, this is not going to go down the same way that we saw COVID go down. We're going to partner. We're going to make sure that our communities know about vaccine availability, vaccine trials that may happen. We're going to respond in a way that is effective for our communities.
It is time for us to acknowledge and address the systemic racism that exists within our healthcare system. We must demand equitable access to healthcare and the resources needed to combat these health disparities. We must also recognize and uplift the efforts of Black communities and organizations that have historically advocated for our own health and wellness. By addressing these issues head on, we can work towards achieving health equity for all.